Hello, I'm Marshawn Butler, Chair of Health Forward Foundation's Board of Directors. Thank you for being with us today. Before the pandemic, we were planning a spring luncheon to celebrate our important work and significant impact over the past 15 years. But then when the COVID-19 pandemic reached the Kansas City region, we immediately shifted our focus to the critical priority of responding to the crisis. The pandemic has challenged all of us in ways we could never imagine. While it feels like there isn't much to celebrate during these difficult times, we feel it is important to take a moment to pause, reflect, and celebrate all that we have done during and before the pandemic to keep our communities safe and healthy. We are here today to thank you, our partners, for your commitment to those most in need and willingness to work towards shared goals. As we engage today, please share your thoughts and questions in the comments section wherever you are viewing this. Toward the end of our time together, we will take a few minutes to catch up and answer those questions. 15 years ago, Health Forward awarded its first grant. The grant was a $25,000 contribution to support the Health Levy Ballot Initiative in Kansas City, Missouri. That small investment by the inaugural Board of Directors has leveraged close to $50 million annually for healthcare in Kansas City. Since that first grant, we have partnered with more than 500 organizations and infused the region with over $300 million in investments that improve health for all. By now, you should have received a commemorative Health Forward coloring book in the mail ahead of today's celebration. If not, no worries. We have plenty of extra copies sitting in the office. The coloring book is a visual representation of the people and communities that have joined us on our journey toward better health. The pages are full of thematic illustrations that we hope you will fill with vibrant colors, creative thinking, and outside-of-the-box ideas. In many ways, it is representative of the very partnerships we formed over the past 15 years. Please continue to color and share these images on your social media channels with the hashtag HealthForward15. That's HealthForward15. Partnering to develop equitable solutions has always been core to our mission. Philanthropy alone cannot eliminate barriers to health. It takes you, me, it takes everyone. Initiatives like Metro Care engage providers to connect uninsured patients to specialty medical treatment. This investment leveraged more than $8 million in a donated service. A 10-year investment to help safety net clinics expand their operating hours resulted in 73,000 additional medical visits patients would not have been able to make during regular business hours. The Healthy Communities Leadership Academy has developed 100 community leaders into empowered change agents who are advocating for policy and environmental change to improve health choices for all, especially those most in need. We amplify community voices by supporting health-related news coverage. Despite the changing media landscape and decline of traditional print resources, we collaborated with our nonprofit media partners. Last year alone, our partners shared more than 1,000 stories about health disparities that in the past were whispered instead of broadcast. We've pushed the boundaries and challenged the status quo by advocating for policy change. We've ensured our communities have clean indoor air and increased the age to purchase tobacco to 21. And just last month, we joined with our Healthcare for Missouri partners to celebrate the passage of Amendment 2, a collective win which expanded Medicaid to more than 230,000 Missourians. All of this would not have been possible without a dedicated board of directors, community advisory committee, and group of associates led by Steve Rowling, Dr. Bridget McCandless, and our new president and CEO, Qiana Thomason. When looking for our next CEO last year, we knew we needed a person to lead health forward through a very deliberate process of exploring what health equity means to us and how we purposefully address race equity to move health forward. Qiana Thomason was our choice then, and her arrival and leadership has reaffirmed our belief that she is made for this moment. A lifelong Kansas Citian and proud native of the 3rd District, Qiana brings a deep firsthand understanding of the complex socioeconomic challenges that come with being uninsured. She's also championed health equity for over 20 years across health policy, healthcare delivery, and healthcare payment sectors. At our founding, our inaugural chair and vice chair, Dr. Harry Jonas and Gurney Gunter, along with the inaugural board and staff, ensured that diversity, equity, and inclusion were the guiding principles upon which Health Forward was formed. As we mark this milestone and anniversary and rededicate ourselves to these guiding principles, we are embarking on a new journey in a new era and time that requires us to more deeply explore and address the social factors that impede health. Even before the murders of George Floyd, Breonna Taylor, and Ahmaud Arbery, Health Forward knew we needed to address inequity as a primary influencer of health. As we sit remotely here today, it's clear that we've reached a pivotal moment in our country's history. Recent police shootings and murders of Black Americans, coupled with the racial disparities in COVID-19 infections and deaths, are laying bare and underlying impacts of structural racism. The moment is calling for change, a new vision, and while we are here today to celebrate, we also want to use this platform to share with you how we plan to move forward in the years to come. Before we welcome Qiana and hear how Health Forward plans to achieve our ultimate vision of healthy people and healthy communities, we want to share a video to thank you, our valued partners, for the many ways you've contributed to a better picture of health for our community.
In 2004, this dedicated group of community leaders were given the task of forming a new foundation to serve the needs of the underserved in our 6-county service area. Now, clearly this foundation from the very beginning wanted to be more than just a funder. We worked hard to be a respectful and thoughtful community resource that collaborates with our funding partners and other community organizations to bring about legislative and systemic change to governmental policies and practices that need to be reformed. I wish Qiana and the Health Forward Board and staff much continued success in taking risks to improve the quality of health in our region for the uninsured and underserved.
Thanks for all your work and all you've done on our Tobacco 21 initiative. Together, the Health Forward Foundation, the Greater Kansas City Chamber of Commerce, and so many other community partners have helped make our community healthier. Through Tobacco 21, we've saved the lives of thousands of area community members.
Over time, I found out it meant that I care about community engagement and I care about capacity building. So taking that right there, anyone can lead at any time, and giving that philosophy to your residents who are trying and haven't had the voice before, and when they believe that, that's when they build power.
I would like to thank the Health Forward Foundation as one of the first organizations that recognized the need for child care for essential healthcare employees. With their generous contribution of $200,000, the YMCA has been able to serve 102 families per week over the past 5 months.
We were able to expand the access to affordable health care to nearly 300,000 Missourians, hardworking Missourians, people that are doing the jobs that we don't necessarily want to do and yet cannot afford health care. You all should be very proud of the work that we did together, the work that you spearheaded at Health Forward Foundation.
As a group, we know that Medicaid expansion is not a political issue, but a practical one that would benefit Kansas health consumers, providers, and their communities in a time of urgent need. Our work would not be possible without the support of the Health Forward Foundation and their partners. Thank you, and happy anniversary.
In your mission to serve the uninsured and underserved, we've been your partner. And over those past 15 years, you've given Swope Health $2.5 million to serve over 44,000 patients in the Kansas City community. We thank you, and we are looking for 15 years more and beyond.
Congratulations, Health Forward, on 15 years of wonderful change in our community, making sure that health belongs to everyone. You've made partnerships, you've brought creativity, you have listened to your community, you continue to work on policy and systemic change, and these are the things that last. Congratulations.
Good morning. Welcome to Health Forward Foundation's 15th anniversary virtual celebration. We are so pleased you're sharing your morning with us as we reflect on our past and set our priorities for our future. I must begin with a heartfelt thank you to our board chair, Marshawn Butler, for her engaged and thoughtful leadership, and the entire Health Forward Foundation family, our current and past board of directors, community advisory committee, our phenomenal associates who I'm fortunate to lead, and my predecessors, Steve Rowling and Dr. Bridget McCandless. I also want to thank our partners for working hand in hand with us in the fulfillment of our mission. Collectively, you are each invaluable contributors to the richness of Health Forward's 15-year journey. It's hard to believe I've already been Health Forward's president and CEO for 8 great and unpredictable months. In this time, we have supported our partners' response to the COVID-19 pandemic by allocating $3.7 million in emergency funding. We led advocacy efforts in partnership with over 75 organizations in Missouri and Kansas to expand collection of COVID-19 data by race, ethnicity, and zip code. And on August 4th, Health Forward, the Yes On To campaign, and over 300 statewide partners successfully drove Missouri Medicaid expansion across the finish line and secured health coverage for more than 230,000 Missourians. These shared successes invigorate me and place the wind at our backs as we prepare for what's next. With our focus aimed forward, I know it's equally important to reflect on where we've been. For me, my journey to Health Forward began over 40 years ago. Born at Truman Medical Center and a young patient of then Swope Parkway Health Center, 2 current Health Forward partners, I stand before you in gratitude as a beneficiary of philanthropic and public investment in human capital. Little did I know that such investments, followed by a game-changing opportunity, would carry my mother, an uninsured, struggling, but buoyant single mother of 3, from public assistance lines to the CEO of Inroads Kansas City. In this role, she equipped and positioned a generation of youth of color for corporate and community leadership. These opportunities would also usher me, a little brown girl from 26 in Woodland, from standing in those same public assistance lines alongside my mother, to the steward of philanthropic assets, which lift others from whence I've come. Anchored by proximity to the communities we serve and having confidence that the collection of my personal and professional experience has led me to this opportunity, I approach this work with immense humility, judicious care, and a resolve for impact. In view of our current reality, nothing less than meaningful and measurable positive impact is acceptable. The uninsured in Missouri and Kansas remain uniquely susceptible to the spread of COVID-19 due to income inequality and long-standing underinvestment in public health. Missouri ranks 51st and Kansas ranks 46th in per capita public health spending. And our bi-state region shares a ranking of 38th for income disparity of our uninsured. These health injustices we've experienced in COVID-19 mortality among Black and brown communities is not new. Health injustices in infant and maternal mortality, higher chronic condition prevalence, and shorter life expectancy have plagued communities of color for centuries. And in Kansas City, a mere 10 miles significantly influences a 15-year shorter life expectancy, the ultimate health outcome for those most in need. Why is that? An abundance of evidence affirms that our socioeconomic conditions, like access to healthy and whole foods, safe and affordable housing, quality education, a livable wage, community violence, and the reverberating impact of structural racism are causal to health outcomes. These root cause factors are known as the social and political determinants of health. I prefer to say influencers of health because, like my mother, people are resilient. When met with asset-building opportunities, the people in our communities and the communities themselves experience improved economic well-being and improved health. Health Forward's mission is to provide leadership, advocacy, and resources that eliminate barriers to health and promote quality health for the uninsured and underserved in our service area. At this critical moment, where the interconnectivity of health, race, and economic inequality are clearer than ever before, Health Forward is reimagining our strategic positioning to accomplish our mission. In doing so, we will not allow current and historical social ills to limit our imagination of what's attainable. We believe in the possibilities of a greater democracy, where all have equal access to power, money, and resources. This fundamental belief undergirds my vision. Health Forward Foundation as a national model for health equity through economic inclusion. Why economic inclusion? I ask, why not? We know the shared experience of our target population is poverty. And we know the underpinnings of poverty are income and wealth inequality and structural racism. This understanding compels us to move upstream to address economic inclusion and race equity as mission-critical imperatives. We cannot achieve healthcare quality or eliminate barriers to health without health equity, and we cannot attain health equity without centering race equity, the condition in which one's racial identity has absolutely no influence on their ability to thrive. As Marshawn noted, prior to the glaring and painful racial injustices of 2020, our board of directors deepened its commitment to diversity, equity, and inclusion by sanctioning the creation of an ad hoc equity committee. This commitment is particularly noteworthy considering the board's demonstrated commitment to inclusion. Since inception, half of Health Forward's board chairs have been people of color. Our current board is composed of 53% people of color. Health Forward's commitment isn't just external, it comes from within. We've created a Culture and Inclusion Officer position, a new role which will help center equity in our policies, practices, people, and systems, in collaboration with our associates and leadership team. We've also partnered with the Race Equity Institute to help establish a common understanding among board and staff of the social construct of race and the insidious impact of structural racism. And finally, we are undergoing a comprehensive equity assessment involving every facet of Health Forward. Through recent examination of our 2019 grant making, we found that of the $20 million awarded, about 18%, or $3.6 million, went to organizations led by, and in most cases serving, people of color. Why is this relevant? Not only is it important for philanthropy to honor the role that people of color have played in wealth creation in our country, we must also leverage their lived experience and fund their expertise in addressing the conditions that improve health in our communities. They are the trusted messengers and best positioned as partners in addressing health injustices. This commitment to inclusion requires deep introspection within Health Forward on what adjustments are necessary to achieve philanthropic justice. Earlier this month, we convened an intimate and transparent conversation with organizations led by and serving people of color. We needed to understand their strengths and challenges in accessing and growing philanthropic funding. This valuable conversation affirmed our belief that we've got good bones when it comes to race equity. But they also challenged us with some uncomfortable truths. They shared that many organizations led by and serving people of color struggle to compete in the arduous application and reporting processes often required by funders. They also spoke of underlying and sometimes unconscious mistrust toward leaders of color and less access to informal, intimate, and trust-based philanthropic networks. These ills pose deep and complex challenges for leaders of color who receive a mere 4% of all philanthropic dollars nationally. Having heard these powerful truths, we now need to do the work. We will examine the ways our norms pose barriers to philanthropic effectiveness. We will look to architect unconventional on-ramps for accessing and sustaining funding for organizations focused on people of color. And we will continue to build authentic, trusting relationships with leaders of all races to build power and assets in Black and Brown communities. We have such a journey ahead in this regard, and we are committed to keeping you abreast of our progress. In looking ahead, we will spend most of 2021 on an internal process of purpose alignment, which is what I call strategic planning. Through this process, we will explore various paths at the nexus of health, economic well-being, and race equity. It is clear that we have philanthropic adjustments to make. We expect our grant-making to evolve, our partnerships to diversify, and our advocacy footprint to broaden. The drivers of health equity and economic inclusion are best addressed via policy and collective impact using metro financing. In other words, pooling local, public, private, and philanthropic funding to improve health. It will take an incredible amount of innovation, collaboration, and bold action to effect change in this way. And while philanthropy is uniquely positioned to lead, we cannot do this alone. We need your partnership around our shared values and strategies. So, join us. Join us in centering race equity in your sphere of influence. Join us in developing equitable, asset-building opportunities with and in communities that improve health and economic well-being. Simply put, asset-building opportunities create and sustain access to power, money, and resources for individuals, families, and communities. It will take time and a continued commitment, but together, we can and will move health forward. Now it's time to hear from you. Let us know how you'll join our commitment. Share a comment or a question in the chat. Before we transition to the question and answer portion of today's convening, we want to share this moving artistry through the spoken word, highlighting work from the KC Voices Collaborative. This regional partnership was created to lift the voices of residents in low-income, racially diverse neighborhoods. In 2019, 5 local artists were commissioned to create works reflecting on racial and economic inequalities associated with nutrition assistance programs, on how food policy shapes access to healthy food. Thank you to our partners, KC Healthy Kids, Community Health Council of Wyandotte County, Groundwork Northeast Revitalization Group, and UMKC Center for Neighborhoods for your work to ensure these voices are heard. In this video, featuring the entire Art for KC Voices collection, spoken word artist Glenn North masterfully shares one of his poignant contributions, The House of Seven Hungers. We are so honored to amplify their powerful voices and narrative.
Somewhere in this city, there is a child who is hungry. There is no breakfast waiting for him when he finishes dressing for school. Although he knows better, he opens the refrigerator, staring into the familiar bright emptiness, an emptiness that resembles the emptiness in his stomach, an emptiness not unlike that found in the chests of politicians, gaping holes where their hearts should be. Politicians who gamble with our children's lives like it's a game, like their lives are disposable, cutting food subsidy programs as casually as one would a deck of cards. Somewhere in this city, that hungry child sits, silent as an empty plate, in the back of a classroom, not able to hear the teacher's words over the insistent growls in his belly. Reading, writing, and arithmetic are not edible, and thus are not a priority. What the child has learned is that the body is a house of 7 hungers. 1, the mind, fixated on food, has room for little else to ponder. 2, the eye, searching for sustenance, will continually wander. 3, the nose, filled with flavorful aromas the tongue will never taste, may foolishly cut itself off just to spite its face. 4, the mouth, constantly craving that which will never touch its lips, will spew venomous words like bullets from a clip. 5, the cells, starving for nutrients they never will absorb, will resort to fast food fixes they can more readily afford. 6, the heart, hungry for love when no one hears its cry, will feed itself the very thing that will cause its demise. 7, the stomach, ever empty, will soon find recompense, and in its maddened state will devour innocence. Somewhere in this city, the child, now a young man since dropping out of school, has too much time on his hands. He attempts to find work, but of course the pickings are slim, trying to divorce himself from hunger before the streets devour him. Meanwhile, back in DC, the 1% complain, too much is not enough when selfish gain is the game. But who pays the price for their pursuit of dividends? In the house of 7 hungers live the 7 deadly sins. And somewhere in this city, the hungry child, now an angry young man, decides to move forward with a poorly thought out plan. And though he has been there 1,000 times before, he points a gun in the face of the cashier at the corner liquor store. Even in his fear, the cashier understands that hunger will bring the thief out of any man. And somewhere in this city, another hungry child awakes to another empty refrigerator, another empty plate. The question is, what is it we will do while the hungry child awaits?
A performance like that centers us and reminds us of our essential purpose, now more than ever before. Now, we'd like you to join us in the conversation. Continue to add your thoughts and questions in the comment section wherever you are viewing this. Please pause a moment while we welcome Health Forward board member and president and CEO of El Centro, Irene Cadillo.
Good morning and welcome. Qiana and I are so excited to answer your questions. We have been distancing and wearing our mask all morning, but we've decided just for this short portion for you to see us and feel us, we're going to take this off. And Qiana, one of the things that I know is probably on the minds of many of you watching, and we're wondering, what do you say to someone that wants to know where their organization fits in to the refined vision?
Yeah, it's certainly the burning question that all of our grantees and partners deserve to understand. Health Forward Foundation will always be and continue to be an anchor partner with respect to funding core healthcare access. So this includes medical health, oral health, and behavioral health care services. Those are what we would consider enduring commitments that are really central to our mission, so a mainstay there. Beyond that, I do think, though, that there are areas for refinement and opportunity even in those areas. Today, the healthcare access is situated in our Mental Health Foundation Defined Grant category and our Safety Net Foundation Defined Grant category. And our funding arrangement there is pretty broadly situated. And when you look at that, it's difficult to discern and achieve a measurable impact in that space. So we'll even need to refine further what we deem core access to healthcare services. And beyond that, we'll focus more upstream on the social influences of health, as I mentioned moments ago, with heavy emphasis on asset building. So those levers that really build power in communities, and there's a lot to consider in that space. There's education, there's home ownership and affordable housing. There's workforce development, and we cannot play, nor should we, in all of those spaces. So it's really about thinking and asking ourselves, where are we uniquely positioned to be impactful in moving health forward? So we will center that question in our purpose alignment process as we move forward. I will assure our partners that you will have voice in and be able to inform our purpose alignment process and how we shake out. So we're looking forward to getting your feedback and what's important to you with respect to building power, money, and resources in community.
So I think a lot about kind of the organization's work and what they do in applications. Talk about if you know, at this point, what you can say about potential changes to the grant application process that people might be thinking about.
Sure. We do anticipate some changes there, mainly because we've heard consistently from our partners that we have some work to do in that space to streamline our application and to make that more accessible, less arduous, less cumbersome. So we will work to streamline that application. But in that, it's important to know that we will need to focus more on gathering race and ethnicity demographic information about our partners and how they are focusing on race and ethnicity and racial equity and health equity. And so, you know, we know that we cannot really change what we're not measuring, and we need to have sufficient data that's coming in from our partners to be able to have measurable impact in that space. So look for changes in the next year or two to the application, and do expect us to request additional information on race and ethnicity.
So Qiana, what do you view as obstacles to achieving success towards this vision?
Well, you know, Irene, I don't spend a whole lot of time focusing on obstacles, but there are some. As I mentioned in my remarks, this work will require deep collaborative partnerships. And in view of the political climate that we're in, it will require the political will of our community to take bold action with us, to be able to build power in communities and to drive health forward in ways that we've not done before. And I'm not saying political will from a partisan standpoint, so don't misunderstand.
Right.
But just the commitment and the determination to rededicate ourselves and reinvigorate our efforts from a collective impact standpoint to address these underlying root cause social ill factors in our community. Outside of that, you know, there's a lot happening right now, and there's some looming uncertainty relative to the Affordable Care Act and its future. So while I don't necessarily see it as an obstacle, depending upon how that shakes out, it may require us to spend more time on basic access to care. We hope that we don't have to reverse course and focus on things that we've long achieved as a country and as a community, but that is a possibility that we intend to advocate against, but certainly need to be prepared for whatever happens.
So I have had the pleasure of taking some of these steps with you in the past 8 months that you have been with the foundation, and we have talked through, over, under, around, and in some cases really just to get to this point. Can you explain to those that are just hearing this for the first time, explain how the foundation developed this refined vision? What were some of the steps that were taken to get here?
Sure. Well, it's really about refocusing and recentering the true essence of philanthropy and reminding ourselves of what that really is, which is different than charity. You know, charity focuses on the immediate needs of the day, the needs of the people.
Right.
Philanthropy is purposed to focus on those strategic upstream factors that shape and drive the conditions of our daily lives. And in doing so, it is undeniable of what underpins poverty. And as I mentioned, we know that that is income and wealth inequality, and that is structural racism that's deep and pervasive and glaring now more than ever. And so in looking at that, the question is, how do we need to align ourselves to be impactful in addressing those upstream factors? And what are the intersections for health? We know that health and wealth are inextricably tied. When your health improves, there's a corresponding improvement. When your wealth improves, there's a corresponding improvement in your health. There's an abundance of evidence about that. And so it's time to focus on the chasm of the wealth gap in our country. And we know that there's a role for philanthropy to play in that space, and we know that that will also improve health and drive health forward.
So I want to talk a little bit about what we'll call measured success We all know it. We've all been told within our organizations. Talk about immediate actions or changes that you hope to implement by the end of the year, but then in years to come.
Sure. So we're currently undergoing a comprehensive equity audit. We are partnering with an organization called Delphi Inc. and looking at every facet of the foundation. Of course, our grant making, as I shared, but also our policy agenda, our vendors, our suppliers, our governance, our staff, and really questioning where can we improve and what are the measures and the benchmarks that we need to begin to establish in those areas to advance equity in all of those spaces. So we intend to have some feedback about that towards the end of the year and spend all of next year using that as the basis and the chassis to inform our purpose alignment process, to ensure that we engineer equity into our focus areas. So that's how we'll use that information. We will also spend time in communication with our partners, sharing more about our journey with you so that you are clear as to where we're headed, what we're measuring, and where we're driving to. And we want to hear from you in that process as well. We'll want to understand your challenges in the race equity space and understand how our grant making and any capacity building and technical assistance that we can provide will help bring you along as well as our core partners.
We definitely appreciate all the questions that are coming in. Qiana, there are some questions around how the foundation plans to engage more in advocacy with such success in the past year. Talk a little bit about the advocacy component.
Yeah. So I frequently have shared with the team that we cannot grant make our way to health equity or to economic inclusion. So this is really about investing more in advocacy and broadening our advocacy footprint in the policy space. And there's a plethora of opportunities to be impactful in that area. We talked about how Missouri and Kansas are underfunded with respect to public health. And how we, above all states, were uniquely situated to suffer in this regard because of the lack of investment. And so we certainly want to spend some attention focusing on our public health infrastructure in Kansas and Missouri. We want to focus considerably on implementing Medicaid expansion and optimizing that and working hand in hand with MoHealthNet and the state administration around that. As well as other social influencers of health. Housing, digital equity is a significant issue right now. We know that kids are unable to participate in the learning process with the same level of access and engagement because of the virtual chasm. So we're looking at how is digital equity situated in our grant making and in our policy agenda, knowing that that will become a public utility for our community. And also critical to telehealth and telemedicine as well. So really beginning to broaden our policy agenda to continue to focus on healthcare access, but also go upstream and focus on those social influencers.
So our board chair, or Health Forward Foundation's board chair, mentioned the right person at the right time. We haven't talked much about COVID. And what that brought in your entrance into the foundation. Talk a little bit about how you prepared, if you were able to prepare, but in reality, this was set up perfectly as the foundation already began to talk about race equity and what COVID uncovered. How did you prepare, and what are some of the things, the lessons learned that you can provide for us?
Well, I wish I could say that I did prepare, but I had 6 weeks with the team in office before COVID hit. So I was still really getting to know the team and getting to know our board and our Community Advisory Council. So being thrust into that, I can say our team rose to the occasion very quickly. And every conversation centered around support to our partners, our grantees. and making sure that to the best of our ability that we could help to stabilize them. So in a war room type situation with a couple of us and being informed from our program officers and others, just thought about how do we architect stability. And quickly, with the board support, determined to allocate $3.7 million. We thought about beyond funding, what else is needed? And it was really flexibility and accommodation. Our partners needed us to show up differently in COVID-19. And so what it really thrust us into is this concept called trust-based philanthropy. And one of the tenets of that is flexible funding, core operating funding, using dollars how you need them to advance the mission and the work. And that was new for us. We've never done that. Our funding in most categories are situated around programs and solutions that are proposed. So advanced $6 million, got that out the door, shared with our all current grantees that they could use the dollars as they needed them, and we've heard over and over again how helpful that has been to our partners because they needed that level of agility. Right. And needed to be nimble as they pursued stability. And beyond that, it's listening right now around what will we need to do. We're still going through COVID. How do we need to show up beyond to help you build the community build resiliency through COVID and after COVID? So a lot of listening, a lot of engaging, and then a lot of care and nurturing of the team, checking in on each other, making sure that we're good. And of course, self-care.
Very important during these unprecedented times. So we very much thank you on behalf of the viewers. Now, we do have a viewer who would love to see a social determinants of health or a social influencer scorecard created for our community so that we can make real headway and educate the general public and others. What are your thoughts?
That's a great concept. I think we need to be in conversation further, so please reach out to us and our program officer team and let us know what you're thinking. We are very focused on community health needs assessments. Most of our hospital systems are doing community health needs assessments, but they don't necessarily key in on the social influences of health. So there's a lot of opportunity in that regard. So I think this is where we need to look at the healthcare ecosystem, our hospital systems, our public health departments, but also our human services sector. And get around a table and think about what are the major and predominant levers to health improvement. What does that look like? We need to engage city and municipal governments in that process and county government with respect to the different conditions that improve health. There's transportation, and we know we have a lot going on in that space right now with respect to zero fare in Kansas City around free access to transportation. Around affordable housing, we know we have a lot of going on around inclusionary zoning in our city, so there's a conversation there. Digital equity is front and center in the city, a lot of collective impact happening there. So what are the major things that we need to be focused on that improve health? And I think it's a wonderful idea to consider a scorecard in that regard.
So we talked about some immediate actions or changes by the end of the year. Also talk about what you see health forward, how you see health forward in the next 5 years.
I see health forward as being a catalyst and an anchor for a new and diverse healthcare workforce. Right now, we know that a lot of health injustices that are occurring, not just in COVID, but before COVID, occur because there's not sufficient representation in the healthcare system, in clinical and non-clinical roles. Health Forward can play a role in that. So how can we work with our hospitals in this community? How can we work with our universities in this community to build a pipeline for Black and brown talent to serve in clinical and non-clinical roles across the healthcare milieu? So that's one opportunity that I see us advancing in Kansas City. Another is building power in partnership with small grassroots organizations, some of which are Black and Brown led. So as a team, we have some design thinking to do towards the end of this year about how we engineer on-ramps for greater inclusion in this regard. And what does building power look like with these communities? And so we need to have the community inform that. But a significant engine that will use community's voice to engage, mobilize, and galvanize around influence around policy making that's community-led. The other thing that I see is us making sure that we are right-sizing public health infrastructure for Missouri and Kansas from a policy perspective. So there are a plethora of opportunities, and those are just a few snippets of what I see ahead.
I truly believe that the viewers out there are plenty who are doing the work and have the answers that we have not supported and need to support. And value that vision and that opportunity for some of our grassroots boots on the ground. You touched a little bit on telehealth and how that has really, COVID has really helped expand that. What are your thoughts about telehealth, and how does it fit in to the future vision of the Health Forward Foundation?
Sure. Well, telehealth will continue to take deeper root. I don't anticipate that our healthcare delivery partners will return to business as usual. So it will become a mainstay, provided that the federal government brings parity to the reimbursement and allows for such with permanency around telehealth. But we also know that this is a significant barrier to health in our rural communities. So in our service area, Allen County and in Lexington, Missouri, there are issues with respect to broadband access. So not only is this an issue with respect to accessing health care, but it's also an issue with respect to workforce and education. So we know that there is an opportunity to consider digital access, a broadband, a utility in our community. So that's a policy play. So really looking at what are the policy levers and who are the key stakeholders in this regard. And there's significant activity and leadership in this space right now. So we're looking to support in this area, not necessarily lead. And we know that our rural communities would benefit from this greatly, as well as greater access to care in our urban communities.
Qiana, we thank you for your time. We appreciate all of you in regard to your questions. I have one final question. You touched a little bit on this, but can you talk to all of us in this viewing audience about self-care and how important that is for you, for your staff, and your partners during this time?
Yeah, it's paramount, and thank you for bringing that up, because I think 2020 has been challenging for all of us, and for many of us, it's been an all-out assault on our mental health. So for me, I am a wife and a mother first. I'm the leader of this wonderful foundation, and I am a leader civically. So I have to always tell myself, Qiana, put the oxygen mask on yourself first before you attempt to help those around you. And it's a frequent reminder. And for me, that's all about nourishing myself, mind, body, and spirit. And so I have some core practices on a daily basis that help me to do that. And beyond that, it's making sure that our team is okay, our team is resourced, our team is empowered, our team is taking vacations. In the social sector, we have to take care of ourselves. So thank you for asking that question. It's a reminder for me as a leader to make sure that I'm doing that and making sure my team is as well.
Thank you.
Thank you so much, Irene.
Time.
Well, that is all the time we have this morning, but the conversation continues. We will address these and other topics on our blog and via our social media channels over the coming days, so stay tuned for that. and in direct conversation with you, our valued community partners. Also, stay tuned for upcoming videos and a new podcast series where we'll sit down with local thought leaders to more deeply explore the interconnectivity between health, race, and economic inclusion. And before we close today, I must thank you again, our valued partners. You have been a cornerstone for our success over these past 15 years. And your virtual presence today was everything. Your energy and engagement and excitement in the chat is all that we had hoped for. So thank you so much for engaging. Please continue to think about how you can partner with us to continue to move health forward so we have more to celebrate in our next anniversary milestone. That's it for now. Make it a great day and be well.